Let's get you an update now on the condition of the DMK patriarch, Mr. Karunanidhi, who has been in hospital for several days now. A medical bulletin that has just been issued by the Kaveri Hospital where he's being treated has said that his condition is on the decline, and how he responds to medical intervention over the next 24 hours is going to be critical. Sam joining us at this point. Sam, what more do we know?
Well, Ankita, a clear decline in the health condition of 94-year-old DMK Chief Karunanidhi. The bulletin from the hospital says there's been a decline in the medical condition of Kalanga Dr. M. Karunanidhi, DMK President. Maintaining his vital organ functions, it says, continues to remain a challenge considering his age-related ailments. He is on continuous monitoring and being treated with active medical support. His response to the medical intervention over the next 24 hours will determine the prognosis. It's not saying anything about what exactly has led to the decline in his health condition, but since morning we have been receiving information from hospital sources and family sources that Dr. Karunanidhi suffered jaundice and liver-related ailments, and he also suffered acute breathing difficulty this morning. And this was also, in a sense, formally announced by the Taminadu Congress President Karunanidhi, who, after meeting the family members of Karunanidhi, briefed the media. And now, in a sense, without revealing the exact health or ailment-related information, the statement says there is a decline in the health condition of Dr. Karunanidhi, and his progress or his condition over the next 24 hours will determine the prognosis. So not a very positive news for the DMK cadre from what we have received from the hospital. As we speak now, around 200 to 300 party cadre are already gathered outside the hospital. And this morning, there were concerns soon after Kanimoli, Karunanidhi's young daughter, visited the hospital quite early than her usual time. And sources in the family said he suffered breathing difficulty and is also fighting what they call liver-related function problems and jaundice. We expect another statement perhaps later tonight, which could give a more clear information on his health condition. But certainly, it's not very positive information on the health condition of Dr. Karunanidhi for the first time. It's the 10th day he is in the hospital. He was originally treated for urinary tract infection and fever. Later, last Friday, he suffered a severe drop in his blood pressure, after which he was brought to the hospital. And immediately after a couple of hours, the hospital bulletin said that blood pressure dip has been stabilized with medical intervention. And the last bulletin we received from the hospital earlier was on the 31st of July, where they talked about the need for extended period of hospitalization and how the liver was altering in its function. And now we received the latest statement that his condition is declining.